Health and Human Services Secretary Robert F. Kennedy Jr. was in Austin for a second day today, this time holding a roundtable on rural health care alongside Governor Greg Abbott. Thanks so much for joining us. I'm Daniel Marin. Jennifer will be back tonight. Today, the state announced it is guaranteed to receive $100 million per year for the next 5 years for rural health care. The money is the state's share of the federal Make America Healthy Again initiative. That's a $50 billion fund. Secretary Kennedy called Texas a model state for passing its own MAHA legislation and said this makes the state a strong candidate to compete for even more of the remaining federal funds in the future. Governor Abbott says the state will use the money to help new mothers, children, seniors, and uninsured Texans while expanding behavioral telehealth to rural parts and increasing staffing in small towns in need of workers.
We have an obligation to ensure that those communities are going to be able to succeed, and an essential component of those communities being able to succeed is having access to health care.
And more than 190 Texas counties, home to nearly 60 million people, qualify as rural. Our Sam Stark goes in depth to take us to one Central Texas community that could really benefit from this influx of cash.
Paint chips off from the sign for the St. Mark's Medical Center in Grange. It once provided emergency services and orthopedic surgery, but it now sits abandoned, leaving a large space in the Grange community.
That's had a huge impact. People were using that hospital to have access to emergency services, and now they don't have that.
Sherry Keller is the CEO of one of the larger healthcare clinics in Grange. She said that since the hospital closed, more people are putting off getting the care they need.
There's an increase of people waiting to the last minute and coming here, and then EMS has to transport them to Austin.
Rural Texas is vital to our state.
On Thursday, government leaders, including Texas Governor Greg Abbott and U.S. Secretary of Health and Human Services Robert F. Kennedy Jr., met to discuss how the state can improve rural health care outcomes.
Rural America is in crisis, and the rural hospitals are absolutely critical for them surviving these crises.
In the past 15 years, more than 20 rural Texas hospitals have closed because of financial issues. Abbott and RFK Jr. celebrated state and federal initiatives recently passed that will infuse more money into improving rural healthcare infrastructure.
Texas provided more than $300 million to address the needs of healthcare in rural Texas.
Keller hopes some of the money makes it down to Grange so the city's hospital might reopen.
Want to move out this way, out to the rural. It's like a dream of everybody in the big city to move out to the country. But then you come out here and there's just not the infrastructure in healthcare.
In Grange, Sam Stark, KXAN News.
Now, there is hope on the horizon for LaGrange. According to reporting from the Fayette County Record, a health group out of Mississippi has a deal to lease and operate St. Mark's. That reporting said some services could be offered at the hospital again in the first half of next year.